Okay, so yeah, it was interesting hearing about Lane County Public Health's rollout of the pediatric vaccines at Lane Event Center. And one thing that they talked about was making a decision to completely remove all Moderna, J&J, and then adult Pfizer shots from the premises. And the reason in doing so was to create like a very clear playing field where medical accidents wouldn't happen, because he talked about how in some instances, just even with adult vaccinations getting messed up, someone comes in for Moderna, gets the Pfizer type of thing. Let me shut this door, sorry. Rupert pushed it open. And so I raised my hand up and I just said, hey, that's daunting. That's really kind of scary, in terms of my plan, which, was to have both sides of that hub center rolling with Whitebird doing adults and then the pediatric on the other side. And he actually thought that was a fine plan. And he really applauded the fact that we had separation of medical teams.
Yep.
Thereby protocols, thereby, people, everything. So it was good to feel validated that, that is feasible and that we can facilitate that. I think, I'm so interested kind of in your take, Anand, because it got super busy. Like we had folks.
Oh, really? Good.
Lined up all the way to the street, such that we ran out and couldn't even get Ian his booster. It was just nuts how many
Ian.
Folks were clamoring there, and I see I've got some real strategies that I'm working on with Eugene Mission about, as soon as we get our equipment there, which they've agreed to store, which is super exciting.
Nice.
We're gonna need to double our volunteers next time and
wow.
Really get like super long, clear lines separated by 6 feet of our own chairs on that lawn, to keep all of the aspects separate, because what we were running into was like so frustrating that folks that had appointments, the line was just doubling up crazy with folks that were walk-ups, right? So essentially now we need 4 separate lines, and and so it's definitely daunting, but I think that high attendance is what we can expect moving forward, given the new partnership or the new location with Eugene Mission. So,
well, that's great, but we're going to need more rocks.
We're going to need a lot more painted rocks. Well, the plan is to use our chairs, instead of those cute rocks. So, although those were dapper, but I mean, now I'm just kind of haunted that, if we have 2 separate sides of the building in their own, age categories of rollout, then we don't really have the 2 egresses that we need then, right? So that's kind of troubling. And then, Whitebird was like, well, what if folks want to have their vaccinations with their kids so that their kids all feel great? It's like, we thought, well, maybe we needed a family room, but I can't co-locate that because then we're mixing staff. So yeah, it's just, I don't want to take all of our time on this, but I certainly, I would really love your input.
Well, there are things that would be nice, and then there's things we just can't do. And I think to some extent, we're going to have to just say, it's a safety protocol. We'd like to, but we can't. Would be my best guess. I think that keeping them completely separated is something that's really going to be required. And I don't think Lane County would really accept it any other way. I mean, they were very happy with what you wanted to do, and for good reason. Yeah. But I don't really think we can combine them.
No, we definitely can't. I'm almost toying with the idea of saying that we can't do adults for the next clinic. Like we may have to go back and forth. Because then then we just switch providers and we really focus on the kids. I mean, it would be super fun to have our friends over at Pro Bono maybe bring some emotional support dogs. Maybe we'll get our bouncy house, Ian. So it's there's a lot to think about with that. Because if we just had one more door on the north side of the building,
Right.
And it would just be done, like each side of the building could be really utilized correctly. We flow in, we flow out, but there's only 3 doors on that long, narrow thing.
Right. Yeah. Tricky.
Yeah.
Well, that's worth considering for sure. That's a definite possibility. I can't think of a better alternative right now offhand.
Right.
You're right. I mean, with the limited number of doors, well, we've got a little bit of time, but not a whole lot.
We do.
Yeah.
And the good news is all of our advertising is going up in
Yeah,
time for that December 12th. So we're going to have great billboards around town that say 5 and up welcome at the wellness clinics.
Do we know what our timeline is for when we have to decide what's going to go up on those?
Oh, yeah, we're done. Our deadline was Monday. So
Oh,
yeah, so yeah, the way I split it up and the way that the billboard company was amenable to was that we have 3 billboards up that are promoting the wellness clinics. And then the other 8 are beautiful, newer renditions of our original public health campaign, the Protect It Together.
yeah.
Emma's just done some stunning work and we are so excited to see them up big. So
Right.
I just got all the advertising proofs for it back today. And so I'm going through them one by one and it's really nice. So, and our range is incredible. We've got stuff all the way from Springfield to Junction City.
Wow.
Yeah, we've moved completely out of the neighborhood in terms of like messaging. So it's quite a thing.
That's fantastic.
Mm.
Doriandra, going back to your point about switching off from pediatric to adults, and we only have 1 clinic scheduled in December, have you thought about doing 1 kid, 1 in December and 1 adult, 1 in December?
Well, we definitely, we're kind of locked into our contract now with Eugene Mission, and they have so many events for holidays, which was my reason for saying we were going to pause on that second one. So the amount of planning that goes into just one is yeah, I don't feel good about adding another one in December, but that is something I'm considering because we've got a hold on all of our Friday dates all the way through June. So that's kind of where I'm naturally leading is to flip them. It's just if everybody can do that, it's like all the parameters, if they all fit, then that may be the best way. So
yeah,
good idea. Yep.
So how many people got vaccinated this last Sunday?
56.
Wow, that's impressive.
Yeah, there was 69 registered, but we ran out. So
wow,
such a bummer. Yeah.
Wow.
So yeah, Whitebird has agreed to both double their vaccinators and their supply next time. And so we'll be moving off of their server, and I'm building us our own sign up form. So we won't have that like thing where people think they're going to Alaska or all the other issues that our lovely, quirky Whitebird platform provides. But so ours will be really specific down to the type, the type of, whether it's booster, Moderna's, all those specific details, so that we will never run out again, because that's part of it, is like they're always guessing. So yeah, we'll just be doubling whatever we get in terms of signups so that we can accommodate walk-ups. So
good. That's excellent. So we had Eugene Bleeds there. Yes.
Yes.
Did we have anybody doing a blood pressure thing?
We had that last time with Lindy at the U of O team.
Right.
But their point in being with us is really a larger goal for them
Ah.
finding people that can be helpful in their own trials. And
Ah.
so they were able to find 2 or 3, but Lindy may not be able to repeat that because of the larger goals of the study.
Sure. Okay.
So, yeah, I've been talking to the folks over at HIV Alliance, and then also I got a couple ideas about people that could, like create our own little public health situation. And I was so
Sure.
excited about the one person, Leah, that just never got back to us.
Ah.
Remember, we were in the loop with her for a while. She
Yep.
seemed such a promising. The woman that's manages the pro bono. Do you know what that organization is? When I met her on Sunday, she was super excited about volunteering. So she may be a new nurse, certified nurse that can jump in. So
Nice.
yeah.
That's cool. Yeah,
So
I know of those people, but I don't know them. So
okay.
so good.
Yeah, they were fabulous. Amazing service they do there, and it overlaps with ours. So we had some trouble at the gate, like how are we getting folks in? It was like a rock concert or something, like too many
Yeah,
people.
I was noticing the string of cars, and I was going like, boy, all these people looking for vaccines. That's amazing. And then I noticed all the animals. I'm going,
Yeah.
oh no, it's pro bono. Yeah, that's right.
Right.
It's really nice that they do that. That is so
Yeah,
cool.
it's really, really cool. Yep.
Well, anything more about the housing stuff or the clinics or anything related to any of that? Yes, Ian.
Did we ever get word on the CLIA and
Oh, the
changing
CLIA
our-
stuff.
Yeah.
Right. No, I haven't done that yet.
Gotcha.
So I needed to make sure that we were definitely doing the mission. And Doriandris told me on Sunday that we got the contract for till what, next June?
Yeah,
Right.
we have a place there until June 2022.
Right. So, okay. Right. I need to find out what the process is with that. We'll need to have somebody from the mission take on the role that Eli was, which is, basically the person who's going to be responsible for the space itself.
Okay.
So we'll need somebody else's signature. I'm hoping we can just get it transferred over. Honestly, I don't know, but I will be working on that process. I'm not sure if it's possible. B, I'm not sure how long it's going to take. And C, I'm not sure exactly what. Well, we'll see. But I will jump on top of it for sure.
Okay, well,
yeah, go ahead.
I'm sorry. Yeah, 2 things. I'm going to go ahead and push into my procurement project that I'm working on now. I've got the PCR test in the queue for Margaret to purchase.
Okay.
So I'm going to go ahead and push so that we get those purchased. And then even if we
Good.
don't sort out our CLIA needs, we'll have them and we'll safely store them so they retain their potency. I think too that by moving over to the Eugene mission, we have accomplished the Lane County Public Health restriction based on only using the CLIA situation in a congregate setting. Suddenly we've
Right.
moved into a place that falls under the network of where that CLIA certification is applicable. So I think we're set to go, and HIV Alliance loses their funding after our clinic in February. So
Right.
that's kind of the goalpost I have.
We should have it sorted out before then.
Great. Okay. And when you need that contact, I'll introduce you through email to, it'll probably be Cheryl that will connect, and it'll be
Most likely.
yeah.
Most likely.
You can get going in a loop there.
Are HIV Alliance still doing testing with us?
Yeah.
They are still doing our COVID testing. That's who you received your COVID test from on Sunday.
Awesome.
So yeah, Brooke received more funding, but it's going to only go till February. So they're the best, and it just is such a bummer that we can't get more folks tested. Like,
Yeah. I know.
I don't know why she has a great sign and everything, and it's part of our anyway, it's part of our services, but I guess folks are moving away from that now.
That's too bad. It's really important.
Not
Yeah.
me.
You got yours.
Good for you.
Yeah. You were only one of 3 that got tested
Oh my
Sunday.
God, people were waiting in line. They could have gotten tested while they waited in line.
I know. We kept doing that too. Hey, anybody need a test? You can get your shaved ice and then you can get a COVID test. You want a burrito nobody was into it. Bummer.
Yeah, it took the last time we did it over at Eli's place, the trying to convince people, we were able to get, I think it was about 11, maybe it was 13. But it took a lot of talking.
Oh,
So yeah, it's not going to come easy. It's going to have to be somebody who's got the ability to convince them. Yeah, so that's a thing, which is too bad. But
I wonder if we'll get more testing at the December clinic because it's like right before the holidays or right before Christmas. I feel like people might be traveling and might want to get tested before they see their family. But then again, like Thanksgiving's next week and only
Yeah.
3 people got tested
yeah,
3 days ago. So
Claire, that's a really excellent idea if you would implement into your social media post.
yeah, some messaging.
December. Yeah, because we'll definitely have HIV Alliance there, and that's a really
Okay, let's do that.
great. We may see those numbers increase just by
Yeah.
simply
Yep.
pointing out the obvious. That's so God.
I want to get tested before I see my parents.
Sure. Yeah, definitely.
yeah. I think that's a good way to convince people.
Mhm.
All righty. I'm going to move on to the survey if you guys don't mind too much. So give me a second here or two. Uh, so can I put files in the chat? Do you know? It might be better if I just, I'll tell you what I'll do is I'm going to see if I can put the
You should be
files.
you should be able to share your screen now. Sorry about that, Anand.
Oh, share a screen? Geez, okay. Hold on, let's see if I can do that. Okay. Is it possible to share if I've got 2 screens? Or have to be the one on the laptop itself? Or do you know?
You can choose which screen you show,
Oh.
and it's only one screen at a time.
Okay,
Once you click share screen, the options should pop up.
I see. Okay. Let's see if, let's try that. Okay, you guys seeing? Are you seeing the survey here?
Yeah,
Okay, so this was the original survey. Well, not the original survey. Went through about 17 iterations before we finally got it out. It was a great collaboration. But you can see we had about 8 or 9 original questions. We had questions about, are you concerned about mostly health related, public safety, air quality, drug use and needles, lead and paint and the environment, mosquito control, environmental issues, train tracks, chemical spills, lack of health care facilities, lack of mental health, emotional and behavioral health. And then the last one on there ended up being dealt with separately, but was really important. And that was, which of these issues would you be willing to invest an hour a week in to help the Whitaker community solve it? So those were the original questions. There was like 3 parts to the survey. The first ones was, what was it that you're concerned about? And of those, give me just a second, I worked this out. 69% were very concerned about drug use and needles. 61% were concerned about lack of mental health care. 46% were very concerned about public safety. Also 46 were very concerned about environmental issues. And then 34% very concerned about lack of health care. And it kind of went down from there. Now, one of the interesting things about it from a community point of view in terms of what we're actually going to be able to work on was if you looked at what were people actually willing to devote their time and energy to, because although drug use in needles was at the very top at 69%, only 18% said they were interested in doing any assistance with it. So that ended up dropping it quite a bit. And it was still an issue for the council in general, but it was something that we were aware if we were going to do it, we probably weren't going to get much in the way of community support, even though they were concerned. We ended up focusing a lot on mental health issues. And I don't know how many of you were involved at the time, but we ended up having a lot of people coming in. We did many presentations. We did presentations from Lane County Mental Health. We did presentations from NAMI. We did presentations from Whitebird Cahoots about what all the various services were, and they were very well attended. We had some of the most members of the community show up for those meetings that we'd ever had. So one of the other things that came out of that, and it was, let's see. And there was one question here that didn't actually get you'll see this next set of questions was what health issues does your household have? So it's a related but different question. And of those, I'll get back to the whole thing in general in a minute. But something that didn't actually show up in the answers at the end, although it did show up on the spreadsheet, was do your household's current expenses for housing and utility costs more than half of your household income? And it was 34% said that it was more than half. Now, that's an interesting statistic because I believe right now it's probably more than 50%, if I'm correct, which shows a progress of how things have gotten worse over time in a fairly short period of time too. I don't know if that's the COVID issue, although I'm sure that's a contributing factor, but that's one of the things that we're talking about in terms of if we can show how things are changing over time. And that's an issue where you've got an actual thing which has gotten worse. And that of course leads to people losing their housing. I mean, that's a big issue when you're starting to spend that much money just to maintain your household. Then we ended up having a question thing at the end, just what is it that you think we might have missed? And we ended up getting some really good questions about that. Also, this one was, so we had two where we just had a place for people to do narratives. One was, what are your major health issues facing your household these days? We had some really great answers for that. And then at the end, like I said, there was the what is it that we haven't brought up? Now, the interesting thing about that is that very last question, what came up more than anything else was housing and homelessness. And that's where I think if we do another survey, we need to really include that as part of the whole health issue, is the housing and homelessness, because it's nothing that really got addressed in that survey at all. And obviously, when you look at the answers that people put out, it's huge. Okay, I'm going to get this one out of the way and actually put up the one that has, let's see. Let's see. I don't think, no, that was the thing that you did, Ian. Sorry.
No worries. I was thinking that maybe a housing survey would be something we could use the grant funding for.
Oh, that'd be great. Yes, absolutely. Absolutely.
I'm not sure if we can. I think we need to ask first, but it seems like since a lot of what you're some pieces of what you're focusing on are kind of ancillary to questions around housing, it might be interested to have a little bit more focus on that specifically.
I'm trying to not share my screen. How do I turn it off?
There will be like a little red bar at the bottom that says stop sharing screen.
Okay, hold on.
Or sometimes if you move your cursor up to the top of your screen.
Got it.
Pulls down.
There we
That's
go.
always been confusing.
Woohoo!
Good.
Okay, I was trying to switch it to something else, but that wasn't happening. This might no. That's the. At some point, you guys might want to look at this if you're just number nerd, but yeah, this was the spreadsheet that Kathy Feely did on the answers. It's got some interesting stuff in it. That's how we found out. Unfortunately, in the other answers section, it didn't have the how many people are spending half their income on household stuff, but you can find that one here. Okay, get rid of that one. Here we go. Here we go. This is the other thing. I think that's it. Yep. Okay. So this is the actual kind of overview of all the answers. Although not all of them make as much sense as I'd like, but you can see from here, we did get about 10% of the people who, of the surveys that we sent out, because we did it a couple of different ways. We sent out 2,400, almost 2,500 surveys out in the mail. And then we got them returned in several different fashions. Some of them got mailed back, some of them got dropped off at Bruns Apple. Some of them got brought back to Central Latino, which was really nice. And Central Latino actually offered to do interpretation services for us, which is why we had that at the very top of the original survey. So if any of our Spanish-speaking neighbors wanted to participate, they were able to do that, which was kind of cool.
I think we got some back from at the market too.
Oh, that's right. That's cool.
I think so.
So let's see. Yeah, here is the thing about what kind of things you're willing to invest some time in. And we didn't really get a ton of responses from that, but at least we got some. We had some really good help from the university in terms of actually designing the format. So this was the question about, what kind of major health issues, also chronic issues and major healthcare issues that people are dealing with.
I got a quick question, Anand.
Sure.
We have 6,000 approved in the budget to kind of recreate this currently in a smaller format. Those neat mailers that are perforated. And I clearly couldn't get this level of specificity, but I wonder if it's something you want to revisit. And either we could change the format so that it has more detail like this into a different type of mailer, but I've been kind of paused, ready to spend this, and it's a really great way to get information back from our community.
Right. I think using community surveys is a really useful tool. It was useful for us when we were dealing with it, and it's something I think we should be doing regularly. I don't know how often. We had thought about doing it every other year, and then we were thinking about maybe doing it every 5 years, but something. And I think, taking the results from it and saying, okay, well, what has this shown us, and what is it that we need to know more about, is probably a really good idea. Oversaturation of alcohol in weed stores. So yeah, that was an interesting thing. A lot of people don't remember this, but long ago, so I was the chair for a while. And one of the things that happened while I was chair was that was just at the beginning of when all the alcohol establishments started moving in. And one of the things that we passed was we weren't going to approve any new alcohol establishments unless they could show why their establishment was going to actually be a net gain for the neighborhood, because we were concerned about overconsumption. But I think that kind of went by the wayside. So c'est la vie. But yeah, I think I'll end up putting these up in the board of directors on the Facebook page so people can access them, because there's some good stuff in there. We can do better, but it was a first try and it wasn't too bad. It's actually started off, there were 2 nurses who live in Whitaker that did a couple of just offhand surveys, and it was from, oh, hi, there's more people. It was from those small starts that it seemed like a good idea to do a more rigorous neighborhood survey. And although not perfect, it was fairly decent, and could certainly be improved on and used for developing more. So yes, Doriandra, I would be happy to work with you on that. And I encourage more of the same, because, when getting grant money and doing other things, asking stuff from the city and the county, if we've got data like that, it sends a good signal. People do tend to listen to it a bit more. Okay, so that's all of that. I got nothing much else to say. Do anybody have any more questions about the survey or anything like that?
I just wanted to say, for those of you who couldn't make the public health and safety meting, I'm going to press stop on the recording right now, and then we'll upload it to YouTube afterwards. I kind of forgot that we should press record, so you're going to miss a little bit, but the juicy, fun, cool stuff is still on there. So I'm going to press stop recording now.